Hi, hello. I am Dr. Sunil. I'm a cataract and refractive surgeon. I have been operating for the last 25 years. And thank you for watching this video. So today I'd like to share knowledge about a different type of cataract surgery. Cataract surgery is basically removing the cataract through a very tiny incision and using an ultrasound energy or a laser energy. And when you use with an ultrasound energy, this is a common technique, it's called phacoemulsification. Phaco means lens, and emulsification, making the lens into tiny fragments and sucking it out through a very tiny incision. And sometimes we can use laser energy to break this cataract and take it out. So it's called laser assisted cataract surgery. So cataract surgery has gone into such a level that it almost mimics, it almost brings back the perfect vision back to a patient when you suffer from cataract. So following cataract surgery, the vision patient get has now become phenomenal with the latest technique like the laser cataract surgery, the stigmatic keratotomy. So many things have made it almost perfect technique with the latest implants technology. But in this latest technique, you cannot apply it in as such. There are some limitations for this. So what I'm trying to tell you today is the limitation of any cataract surgery, that because the anesthesia we use for cataract surgery, basically the local anesthesia, and when you use drops as anesthesia, is called topical anesthesia, which is the best technique we can use as anesthesia because it avoids a painful injection. But this technique you cannot apply to 100% of patient because some of the cataracts will be very hard and complicated, so it might take more time to remove it. So patient may not be able to stand that much of time, or in some cases it demands an open technique in which we have to convert a keyhole surgery into an open technique. Or sometimes there is complications that are expected. You tend to start the surgery with an injectable anesthesia. So today I would like to share, there is a technique which I have designed in such a way that the anesthesia is designed in such a way that which can be applied almost 100% of all the types of cataract, including back cataracts, including subluxated cataract. So all the complications of cataract can also be taken care by using this technique. So it is almost 100% injectable anesthesia free and just topical anesthesia. So 100% topical anesthesia is applicable to this specialized technique. And the other aspect of this surgery is that the post-operative care of following cataract surgery, you know that after doing the surgery, you may have to put drops every 2 hourly in the first week and 4 hourly in the second week, like that. And the use of steroid is very high. So this actually makes a person really the person taking care of the cataract, the patient is really tough to administer the drops every 2 hourly. One will have to take a lot of care and administer the drops. The frequency, the types of the drops have to take very special care. So this surgery has made it in such a way that the number of drops are very minimum of 2 or 3, and the installations of using drops are just made into twice per day or once per day, like that. So this makes the patient very simple to remember the frequency of the drops, and not only for the patient taking care of it very easy. So once you put a drops in the morning, it need to administer drops only in the night. So it makes a gap of 12 hours, which makes anybody can take care of the patient. You don't need to take some specific dedicated time for the patient, because once you put the drops in the morning, you can go to work and come back and put the drops for the patient. So this made a very big advantage. And the other thing is that because it has become 100% injection free, you don't need to stop any of the medicines patient is on, like the anticoagulants, which is normally being continued, and some of the physician never permits to stop these medicines because of the increased risk of the patient going for stroke or heart attack during surgery. So this physician really scared of stopping this medicine, and some patients, they do have a time like that. Once you stop it, is giving it back to the normal level. It also takes some time. But this anesthesia technique, which is almost 100% topical, it is possible to 100% continuation of the medicines the patient is on. So this makes a big advantage of patients not stopping any medicine and not taking any risk. And this medicine is also the frequency of the drop is simplified in such a way that it's made a program like patient easy to remember the program. Putting the drops is very simplified. So any patient this can be applied, and it is very useful to patients with a lot of medicines where there are so many things we'll have to take care. So this has become the cataract surgery very simple and with phenomenal result. Thank you.